Welcome to the third dimension. For the past decade, Yemen has stood as one of the world's gravest humanitarian disasters, with more than 20 million people in need of aid. Yet, in the midst of the cacophony of war, a haunting silence surrounds millions of innocent Yemeni children caught in the crossfire. Hundreds of thousands of children in Yemen face life-threatening malnutrition. Millions lack access to health care or clean water, and some have been drafted as soldiers in the decade-old war, according to UNICEF. Yemeni children are the hidden victims, unseen and unheard, who bear the heaviest toll of a conflict they had no part in igniting. Stripped of their laughter, dreams and security, they are left to navigate a world tainted by trauma and heartbreak. And as the world remains preoccupied with geopolitical maneuvers and global concerns, these young souls continue to endure the grim consequences of the conflict. But despite these enormous challenges, there are pathways to reduce the harm inflicted on Yemeni children. Humanitarian organizations like UNICEF work to provide safe spaces for children to eat, play, learn, and heal. These interventions, while simple, are crucial for giving children a sense of normalcy during chaos. To discuss this topic, I'm delighted to be joined by Mr. Peter Hawkins, the UNICEF representative to Yemen. Before that, Mr. Hawkins was UNICEF's representative in Nigeria and Iraq. Peter also worked with Save the Children United Kingdom. He holds an advanced degree in law and a Bachelor of Arts with honours in African language from the University of London. Peter, welcome to the programme.
Thank you very much, and thank you very much, Dr. Hassan, for having me today.
Okay.
An important day for Yemen and for us all.
Okay, thank you. Okay. Now, if we may start with your March briefing in Geneva, when you were giving a briefing on the situation for Yemeni children after 10 years of conflict, and let me quote you, you said, "Today I stand before you not only to share numbers, but to amplify the voices of millions of children trapped in one of the world's worst protracted humanitarian crises, a crisis defined by hunger, deprivation, and now a worrying escalation." End of quote. What a frightening definition of the Yemeni crisis, Peter, isn't it?
It is, absolutely, and it really illustrates I think it's probably the frustration of women, girls and boys not being able to meet their full potential. The hunger. One of the statistics that I keep repeating is 48% of children under the age of 5 are what we call stunted, i.e. their micronutrient intake has been constrained, and therefore their cognitive and physical development is also being constrained. So they, at that age, will not be able to fulfill their full potential when they grow up. So the impact of today is not only going to affect children today and tomorrow, but it will affect the country and its economy and its social fabric in the future. So really, it's so, this capture of problems that we are seeing today, it's not only going to be met today, but it's the future of this incredible country.
Okay, as you've started with hunger, Mr. Peter, okay, and an estimated 2.2 million cases of children are acutely malnourished, including around 540,000 children suffering from severe acute malnutrition. Okay? And in your words, again, you said in Yemen, it is not a health crisis, it is a death sentence for thousands. The question is, Peter, what are the high-risk areas of malnutrition in Yemen? And tell us about the UNICEF response in that regard.
The most extreme areas are the west coast, right way from north down to south, especially the southwest, but also the highlands around Hodeidah, Hajjah, Rayman, Sada, and then when you move across to Marib and parts of Marib and around there. What we at UNICEF have been doing now for 3 years, and we will continue to do this, is to prioritize our actions. First and foremost, to make sure that primary healthcare reaches all children across the country. We support 3,200 primary healthcare centres with a minimum package that's around maternal and newborn children, it's around immunisation, and it's around nutrition. And it's really to help women, girls and boys have the prerequisites for their own development and survival. The second is really in the most priority areas, in parts of Rayman, in parts of Hodeidah, Hajjah, in the southwest, in Mocha, in parts of Taiz, where malnutrition and acute malnutrition is at its worst, is to make sure that we can reach out to these remote communities and ensure that children receive the services that is so essential, whether on nutrition, which is critical at this point in time, coming up to the hunger season, or in immunization to make sure that they are immunized against the diseases.
Okay. Now, if we turn to another vital issue affecting Yemeni children and is also a focus of the UNICEF, is the issue of education, Mr. Hawkins. Okay? And the statistics here, they say around 2 million children are out of schools. So the question is, I can't imagine what the future holds for this generation, Mr. Peter.
And it's much more than that. And I think this is the catastrophe that is happening now. As children are unable to go to school, either because the school doesn't exist, or they're too poor to be able to afford to be able to go to school. But even when they get to school, I mean, this is for me the catastrophe of what is happening today. Yeah. Is the facilities are not there. The teachers frequently are not there. The dedication of the teachers is exceptional. But when you have a school that is completely destroyed and you have to sit on the floor, have to try and work through, through all the different elements, rain, sun, floods that happened.
So Peter, perhaps the dedication of the teacher has been impacted by the salaries are not being paid.
Absolutely, salaries are not being paid. They rely on incentives that organizations such as UNICEF provide around the country.
Yeah.
But also they rely on their own community involvement. Now, teachers are the most important parts of our lives.
Yes.
I remember my teachers' names. I am sure you do,
yeah.
Dr. Hassan,
yeah.
at a very young age.
Yeah.
These people are there. I was in Raza some time ago,
yeah.
Driving along, and I came across this complete skeleton of a school. No walls, no nothing. The floors uneven and the staircases broken. And yet the kids were there. The teachers were there. They wanted to learn. They wanted to share their knowledge. It's that partnership is so critical. And one little boy came up to me and said he had his English class exam that morning. Yeah. He sat in the corner. He showed me where he sat. He dried a little patch where there was no water, and he sat there and he did his English exam. That's the future of the country, but yeah. we have to give them the basis from which to do it.
Okay. One of your initiatives, okay, to boost up educations for Yemenis, Mr. Peter, is education in emergencies, okay? Would you please elaborate a bit on this?
One of the manifestations of conflict and economic collapse is that children and people move around. So it's trying to ensure that those children, especially those displaced, have informal education or catch-up education so they can go back into the formal education. For those children who are born in areas where there have been no schools, is give them, and then they've grown up, give them some sort of informal education for 9 months so they can catch up and go back into a classroom or go into a classroom for the very first time. It's so critical that we do give them a chance in life. But then also at the school level is to bring those children back in. So back to school clubs and facilities. School-based grants, they are essential to give disposable income to schools so they can reach out to their communities to bring in those children, show the community the benefits of education, the benefits of learning, and bring those children back in.
Yeah. So these motivated children you are talking about, Mr. Hawkins, needs also protection, okay? And it's very unfortunate when you see children at the age of schools carrying guns in the streets and checkpoints. And this brings me to the issue of child soldiers, Mr. Hawkins, which is really, really, really an annoying violation, okay? The question is, to what extent is UNICEF engaged with the warring parties to tackle this issue?
I think over the years we've been able to work with the authorities, with the different armed groups, to be able to improve that at a formal level. So age determination for recruitment, recruitment practices to stop children under the age of 18 being recruited, agreements whereby the military entities themselves have signed up to not wanting to have children under the age of 18 come in. And the drop in the number of child recruitments or children under the age of 18 in armed groups throughout the country has been incredibly significant. The challenge are the informal situations whereby a father or brother or something will go and work in a military camp, and then the young son or the young brother comes along, brings the food, gets involved, and then before you know it, as you quite rightly described, they have a gun in their hands. And it's that informal network, the tribal to crossover with military network, that is where we have to focus on now, to try and stop the children who, let's face it, this is an income for them. This is they're providing for their family members, and to give them alternative in life. And one of the key areas is school rather than labor.
Yeah. Okay. As we talking about children and child soldiers, Mr. Hawkins. Okay. I was just going through the UN recent report on children in armed conflict, and I was a bit surprised to learn that the Houthis and another entity in the south, they were removed from the list of shame, what is called the list of shame, okay? Because they say it is a UN criteria when they find that this particular non-government actor or non-state actor is not cooperating, okay? I just want you to elaborate on this criteria, and don't you think this criteria also encourages parties to recruit children?
On the contrary, I mean, the listing of non-state actors or armed groups is the prerogative of the Secretary General.
Yeah.
And the Secretary General has determined for in Yemen, for the two who have been listed, to drop the listing on a critical area, which is on schools and hospitals
Yeah.
and the violations there is. The whole point of listing is to incentivize these armed groups and non-state actors into actually improving the situation within it. And what I was talking about there on recruitment, a lot has been done. A lot has been tried to do to prevent children from being
Yeah.
being recruited or being subject to the violations perpetrated by anybody. And it really has been very important that we recognize that, but there's still a lot more to do.
Okay. Okay. When you were talking about your operations, UNICEF operations in the West Coast or in Rama, in different places, this brings me to the issue of what are the field challenges faced by UNICEF operations, either in Houthi controlled areas or in government held areas? I mean, field challenges, yeah.
Yeah. And you know the country well,
Yeah.
and you know how difficult it is to transgress the country. It's a beautiful, beautiful country, but you've got these deep valleys, high mountains. The populations are up there, right on the top of the mountains, and reaching them, especially what we call the tier 3 population, is exceptionally difficult. So that is the primary problem, transgressing across the country. The second is the issue of scale. Over the past 10 years, the scale of this catastrophe has been such that trying to meet the full needs of the population has been very, very, very difficult. And prioritizing the most acute, the most vulnerable is the way forward. But trying to do that in a country as large and as diverse as Yemen is so, so difficult. But we're trying to do that. We've what we call targeting, prioritizing certain governorates and certainly certain districts, especially on nutrition, so that we can actually have an impact on those families, on those children in real time. Shift the needle, as I keep telling our team. But the third is the environment in which we're working in, and we can see this. The three major catastrophes in this region: Sudan, Gaza, Yemen. These are enormous challenges that the world is faced with at a time when the world is changing the way it looks at international humanitarian efforts. So, and that has a profound impact. The collaboration with local authorities and governments becomes more fractured as you try and bring about change in a different way. You've got the problems of absolute resources. It's dropped significantly, but I'm convinced that if we prioritize better, that drop in resources will not have an impact. It's about choices that we can make.
Yeah, so you've just raised it now, the resources issue, and this brings me to the issue of funding crisis that UNICEF is facing. And we know, Mr. Hawkins, that the United States is the largest donor to Yemen and to UNICEF in particular. My question is, how have the US cuts impacted UNICEF operations in Yemen?
We're very, very lucky. I mean, you're right. The US contribution was significant in Yemen. For us, it was probably about 20%, 25%. But there are other donors who have been equally generous: the Qatar government, the Kingdom of Saudi Arabia, the UK government, German government, and the Swedish government, and all these other entities that have been equally generous, and they have continued. But I think my point here is, if we prioritize and we prioritize properly, which is very difficult in a country like Yemen, where we're targeting our assistance in the right way, we can reach the most vulnerable, and we can continue to reach the results that we're trying to achieve, which at the end of the day is reducing mortality. It's reducing morbidity. It's ensuring that more children go into school than have done before. And all of these factors, we've got to be more professional, greater targeting, and less worried about how much money we get. Let's deliver the results.
Okay. A final point, if you may, Mr. Hawkins. Okay. Yeah. If I go back to your briefing in Geneva in March, where you described, okay, you said, describing the Yemeni crisis, this catastrophe is not natural, it is man-made. Building on this, Mr. Hawkins, what message would you like to say to the warring parties who caused this man-made catastrophe?
It's international, it's regional, and it's local, all of them. What I would say to all of them is the humanitarian imperative is critical. We must be able to continue and ensure that we meet the critical needs of a population in Yemen. And that not only means feeding a child, making sure a child is immunized or a child goes to school. It's also the services, is maintaining the minimum services right across the country. The primary healthcare system, the primary education system, the informal learning processes, cash provision, food assistance. All of these things have to continue. The rest, the people themselves can start to do. In terms of what is happening in Yemen today and tomorrow, the critical factor that needs to be resolved, first and foremost, is the economic division that the country is faced with. The economy has to be able to function so that people themselves can be lifted by that, can contribute by it. This is the social divide. It's a divided country. There are now roads from Sana'a to Aden, through Taiz, through Ndala. It's opening those means of communication so people themselves can continue irrespective of the differences others might have. So the economic and the social, let's resolve that, but make sure the services are an integral part of life-saving and meeting the immediate needs of the population.
Okay. A final word to the vulnerable Yemeni children, Mr. Hawkins?
Final word is programs like this really help us to amplify the problem and find that solution. Let's work together with the media. Let's work together with the authorities in partnership. Let's work together with the international community to ensure that Yemen receives the absolute minimum requirement to ensure this country can stand back on its feet. We've been successful up until now. We need to realize that investment for the next 5 years. Okay.
This brings us to the end of this interview, Mr. Hawkins. Thank you so much for your time and insights, and thank you for talking to Yemen Today TV.
Dr. Hassan, thank you very much, and thank you very much to Yemen Today for the time they've given me. Thank you.
Thank you. That's all for this time. See you next week with a new edition of The Third Dimension.